Well, here we are nearing the month of May, and we know that it is Mental Health Awareness Month. And we've talked about several times on this show how people who are facing addiction or isolation and mental health issues, those tended to increase during the pandemic. And we're so excited that we are able to introduce, or in this case, welcome back the lovely Antoinette Hagley, who's from DACCO, which is the behavioral health organization that is a part of our show to help share important information today. Antoinette, good morning. It's good to see you.
Same here. I'm so glad to be here.
I touched on, of course, the pandemic and Mental Health Awareness Month. And as a behavioral health organization, I know there are several things that you face, and most importantly, you help others face and treat. What have you been seeing the past few months here?
We've been seeing a return to the numbers of what we expected of people in our community seeking support and help. During the actual pandemic, we saw a little bit of a reduction in those numbers as people tended to isolate and seek more of their physical well-being. But now that things are opening up again and people are more visible to their loved ones, we are seeing people coming out and getting help and seeking the help that they need.
Well, of course, you can receive that help from DACCO. If you will, and if people are not familiar of the acronym and what you're all about, explain what DACCO is and why your vision and mission to help the community is really important.
So we are a behavioral health agency, and we've been in the Tampa community since the 70s. We've been serving the community one person, one family at a time. And we've really done this by being flexible and responsive to our community's needs. So we try to set the standard of excellence in behavioral health service delivery. And among the things that we do really, really well is identify co-occurring mental health and addiction. So we've been well known for addiction services and emerged as a leader in that area. But one of the things that we've also really honed in on is how to help people with mental illness and how to really help people to achieve mental wellness.
And I'm glad we're talking about that. And you did touch on the addiction. I think that's what we've talked about in the past, that you
Yes.
do offer residential and outpatient services for those who are struggling with the disease of addiction. But the mental health side of things, what does that mental health picture look like for those who may be like on the line of, do I go ahead, pick up, call, get information, or do I continue to see if I can do this on my own?
Well, I think the word illness versus wellness is what confuses a lot of people, because we think of mental illness as psychotic break and or really deep end issues, when in fact illness exists on a continuum, and mental illness also does that. So it takes all forms, shapes, and sizes, but it really starts with kind of differences in how you internalize your sense of self, your feeling, your experience of others. That's what the person feels when they're starting to recognize that they're experiencing mental illness. And in our case, we have a huge team of licensed clinicians, nurses, doctors. We work closely with Tampa Family Health so that we do a full evaluation of someone's wellness and try to determine where their source of actual illness or where the discomfort, where is the distress coming from, so that we can decide and work with the patient to determine what the intervention should be and where we should start in helping that person to achieve balance.
We've got under a minute left, Antoinette, and you just changed my way of thinking. Mental wellness, that's something that I'm going to hold on to moving forward. And perhaps, though, I would like to maybe end this segment, though, talking about a family member or friends. Say you're starting to recognize maybe some problems when it comes to the mental wellness of an individual. Are they able to pick up the phone and give you a call and talk with someone to see how they can help that situation?
Absolutely. We have an engagement center that we're starting up that is aimed at doing just what you're describing, where we have engagement specialists who, if you call the number that 813-384-4000, we have staff who can work with you to educate on what the best thing to do, what the next steps should be, and to really identify how to work with your loved one.
And again, just being able to talk about how DACCO is more than just helping those with addiction. They're also helping behavioral health and, of course, that mental wellness we talked about today. Antoinette, thanks for being with us.